Now to get Covered Jax, thousands of people in Northeast Florida have signed up for new health care coverage since enrollment opened last month. And you still have time to sign up as well. There are more than 26,000 new enrollees here in Duval County, nearly 4,500 new signups in St. Johns County, and more than 4,100 in Clay County, and nearly 1,400 in Nassau County. That just gives you some perspective. But we know that there are more of you who need to enroll who don't have health insurance. Jacksonville Mayor Donna Deegan is joining us this morning in studio as an important deadline approaches. And we want to point that out to you. People have until this Friday to get signed up if you want your new coverage to start on January 1st. Right. It's not the deadline to enroll, but at least you have to do it by then to be able to get that coverage by January 1st. Thank you for being here. We appreciate you. And I know this is so important. We were talking about this on off air, why this is so important. Would you explain this push now by the city and by your office?
Well, I always have said, and this comes from my 20 years with the foundation, where we switched at some point to a navigation model where we connected people with navigators, and we recognized how much success that brought to them in terms of their level of comfort, their level of engagement with what was available to them. And so we thought if we could just educate plus navigate for people, we could get a lot more people signed up. And you're looking at a 22% increase. This is the biggest increase we've ever seen in this short a period of time. And I'm so excited about it because, you know, this will save us so much money, not only in our city, but for people's peace of mind and for their health. And I think that's fundamental to our health as a community. So I think this navigation model, I always tell people a confused mind says no. If you can connect people to information and navigation, we can get more people signed up. And what a lot of people don't know, Jen, is that there are programs out there. There are plans that are $0 that can get you things like mammograms and yearly checkups and all those things. And then you're also covered for that catastrophe. So if we can just get more people connected, and I know you guys have done such a great job. I heard you had like 60 people on waiting the last time that you had a phone bank.
Right, so we had the phone bank. We're actually going to have one, and I'll give that information to our viewers in just a moment later today as well. I mean, but the point here, and for those of you maybe who haven't heard about this is essentially, you know, marketplace insurance plans that are available through the state, yes, offered through the Affordable Care Act. Right. These are plans that come in different, you know, shapes and sizes, so to speak, in terms of costs. And the reality is that there are many people who are watching us this morning who don't have health insurance, who think I could never be able to afford it, yep, that can afford it. It's just by simply, I want to explain the Navigator, yes, if we could, because there was a lot of confusion as we were talking about the phone bank. People calling in, they weren't sure about the process, they weren't sure about the cost. The city is your office is basically helping connect our viewers and anyone who doesn't have insurance with people who can walk them through the process.
That's the beauty of a Navigator system. So all they have to do is go to the website, they go to getcoveredjax.com, and once they start the process, they're connected with a navigator that can then help them determine what program is best for them. So you don't have to do any of this by yourself. All you have to do is either call your hotline. I know you guys are going to be up later today, or go to the website and you'll get instantly connected to somebody. You'll just choose it, connect to a navigator, and somebody can walk you through every program that's out there. And depending on your income, there's like I said, there are so many low cost or no cost plans out there, and it's life changing for people, life changing.
And I want to, because I have something else I wanted to talk to you about, because you certainly have a great perspective, you know, on the importance of health insurance. But while we're talking, I want to pull up on the screen the no cost coverage, because there is an assumption, and you touched on this, Mayor, there is an assumption that people think, oh, this is only going to cover me if I get really, really sick at the last minute, or I have an accident and I have to go in the hospital. Yeah. That is just simply not true. These are the plans we'll show you in just a minute. And this is, as a breast cancer survivor, you know, you've talked to women in particular about the importance of health insurance and having just some way of covering costs that can be just magnified without it.
Well, and I know firsthand the panic the mind goes through when you're first diagnosed with something like that, right? Or just when you're facing a healthcare crisis. It's so important to have somebody that can just hold your hand and say, here's what we can do for you. Here's how you can connect. But beyond that, just knowing there's a safety net there for you. I mean, this is a big, big deal in people's lives. And also it will keep people from simply going to the emergency room every time they get sick, which costs us a ton of money regardless. So
costs all of us, even those of us who have insurance.
That's why I try to say to people, even if you don't think this is you, if this is not something that affects you, it does affect you because it affects the bottom line for every one of us. But to me, to be able to give people that peace of mind, and if you're healthy, you can go to work, you can pay your bills, you can take care of your family. If you're not, you know, we've got all sorts of really unfortunate health indicators in our area. Our infant and maternal mortality, there are a number of different primary health measures in Jacksonville that are really very, very poor despite our really great health care here. And that really comes down to educating people to know what's available to them so that they can then access it and we can start moving those numbers. And I'm really grateful that that council also sees the value in all this. I mean, it's been a good partnership so far in trying to make sure that all of this, you know, has happened. And I'm excited about continuing that process because education, at least from our level, is not expensive. You know, it takes partnerships with the media, with our faith-based organizations, with all the partners that we have in the community, and we can all come together and educate people. And it's a very low-cost way to really move the dial on a problem that's very big.
So, in case our viewers missed it, because we touched on this, and I don't know the information popped up on the screen, we're talking about yearly exams, right? Yep. Screenings, blood work, colonoscopies, mammograms, pap smears, immunizations such as the flu vaccine or shingles vaccine, as an example. These are all things that are covered at no cost through some of the plans that are offered through the Marketplace Health Plan. Mental health services are also available.
Absolutely.
You know, anything for your children is available. Vision is also available. So it's a long list of the options that are there, and you just have to get the education to find out about it. Mayor, thank you.
Thank you so much for being a partner in this. I can't tell you how much we appreciate you, and I know your phone bank is this afternoon and then into the evening. So please, folks, access it and make sure you get that coverage.
100%, and we love being involved in these kinds of projects because we want to help you stay healthy. We want to help you and your family stay healthy. So here's what you need to know about later today as well. So we are going to have a phone bank. It opens at noon today and runs until 7 o'clock. At that time, you can get any questions that you might have about the marketplace and what coverage is available. You can get those answered. You can also make an appointment so that you can set an appointment with a navigator who can then help walk you through the process and make sure you're enrolled. Important deadline. You need to sign up by this Friday in order to have coverage by January 1st. The deadline, though, extends. It just means that any time that you enroll after Friday means that your insurance will not take effect until February 1st. Much more certainly throughout the day. Again, Mayor, thank you for being here. We will provide you the phone number to call when our lines open at noon.